The Healthier Working Futures programme was created as a result of a successful bid to the UK Government's UK Community Renewal Fund. It was led by the Leeds Health and Care Academy, the Lighthouse Futures Trust and the East Leeds Project, under the administration of the West Yorkshire Combined Authority. The ambition was to raise the aspirations of young people in Leeds who face barriers to training and employment, and help them discover opportunities in the health and care sector. From the start, the bid focused on involving third sector organisations, realising that new thinking and new ways of working were needed to reach the young people who might benefit from a career in health and care. After engaging young people in a series of workshops, events, work experience opportunities and seminars, we followed up with off-the-shelf workshops, training sessions, one-to-one support and team sessions to build confidence, develop skills and explore further opportunities, before finally connecting young people to employers, apprenticeships, training, work experience and education.
Healthier Working Futures is a programme which is all about working with people who live in areas of Leeds that are categorised as economically deprived, and targets young people who experience some form of inequality, such as learning difficulties or disabilities, social, emotional or mental health issues, or who have not continued with education.
5 core community partners were involved from the beginning, but we also engaged with several other charities, community organisations, schools, colleges and employment programmes.
So today we're hosting our first of 3-day event at Shine in Hare Hills. The idea is that we are going to inspire and attract our future workforce within the health and care system. So through the use of interactive activities, we're going to enable people to have a hands-on experience about what some of the roles may look like in practice. Our ambition today is not only to attract and inspire our future workforce, it's to also show them how they will get in, get on and go further.
The Lighthouse Futures Trust offered young people a programme of group sessions and one-to-one mentoring. Anya, the Health and Care Talent Lead for Leeds Health and Care Academy, worked with the Lighthouse Futures Trust.
So there's lots of amazing opportunities amongst the health and care sector in Leeds. We've got opportunities with IT, care assistants, clinical support workers working in hospitals and care homes.
You get the experience, like you come out your comfort zone so you know what you want to do. Doing horticulture, I found that my strongest point.
Anya worked with young people preparing for job interviews during one-to-one sessions.
I always want to help people, I feel good helping people. And then I thought maybe what if I wanted to do like social care, like definitely with more like elderly that need it and you know they're stuck in that little home. And I'd love to make their day a little bit brighter.
I'm looking to go into IT with the hardware side, so looking at computers, fixing them and possibly installing them into workstations as well.
I wanted to join the programme because I wanted to look for work and apply for jobs and make new friends.
Healthy Working Futures, I've been applying for a job of making snacks and coffees for old people at the care home and looking after them.
The East Leeds Project held a series of workshops using their mobile makerspace kiosk as an innovative way of engaging young people in conversations about their futures.
I think there's a lot of pressure on students these days to get their qualifications, and that means they miss the softer skills, so the team working skills, the communication skills that are so vital in any job that they do, and they don't always get the opportunity to do those.
The principal challenge is about bringing creative practices into contact with careers in health and social care, and also provide a basis for some really fruitful conversations between young people about the kinds of skills that they might take to these jobs.
I think that it allows a safe space for people to work in, and we can have conversations which wouldn't necessarily arisen in a formal setting.
We wanted to be a part of it because we really like to be involved in our community and encouraging those people who've been long-term unemployed into work. The NHS are involved, the council are involved, and lots of the partners are involved. Everybody's working together, putting on different courses, work experience days, there's support at the end of the line. So it feels like we're part of a real collaborative project. We want to engage with the young people when we're here, let them know that we'll give them a call back and follow up with options that might be available to them.
Throughout the Healthier Working Futures programme, iCare ambassadors, health and care employees who volunteer to talk about their roles, engaged with candidates to share their experiences of working in health and social care in order to help people make informed decisions about their careers.
As an iCare ambassador, you're making sure that young people are introduced to the idea of delivering care. The main concerns of young people who are looking at employment in care are a lack of confidence, and they need to build that confidence through either special projects or good induction, but generally they just need to have someone around, like an iCare ambassador, who's saying, you know, you've got the right skills, you can do this.
The feedback shows that the young people who attended the sessions developed their confidence and skills, and many were inspired to seriously consider a future career in the wider health and social care sector.
128 young people were helped with job searching. 70 received an accredited qualification, 55 were helped to access training, and 20 were guided into paid employment.
I enjoy different challenges, doing something new, because I've never done these kind of things before, so I just wanted to try it and I enjoyed it.
I got the opportunity to try new things that I've never tried before.
I've got a job at St James's Hospital doing horticulture, the job that I wanted to do. I do gardening, I do cutting grass, cutting edges, litter picking, sweeping up, looking after the hospital day to day basically.